Welcome back to News 12. Hundreds of Orange County healthcare workers are joining to try and unionize their hospital. Union supporters at St. Anthony's in Warwick say bringing a union into the hospital and two of its nursing facilities would actually ensure better pay, pensions, and health care for employees. They've started the process and hope to vote on joining the local chapter of the SEIU by October. But some workers say the hospital has been resisting the move.
Actually, getting the majority was easy. That was the easy part. Going forward is the hard part because our employer is actually trying to stop us any way can. They've actually hired an anti-union work group to come in and try to oppose the union.
Now, a spokesperson for St. Anthony's says it just wants employees to have all the facts before they vote on whether or not to join a union. The spokesperson adds if the union is what the employees want, then the hospital will be supportive of their vote.
My husband and I were both able to get a lot of dental work done, which was wonderful. And I can't say enough about that. In fact, I'll say to people, you should join the union. Look how nice my teeth are.
You know, you have to take care of yourself. And one way of doing that is get involved with 1199.
They have a retirement program, so I don't have to worry. When it's time for me to retire, I will have an income coming in from $11.99. I will also have medical benefits coming from $11.99 that I don't have to worry about.
I asked on a monthly basis what I would be getting. They told me $414. So right now, that's what I'm getting, and it's not enough. I have to get a job.
My mother worked for Mount Alverno for 20 years, and after 20 years she retired. And when it came time to get her pension, she found out she was only going to get $274, which she realized she lost 10 years from the Archdiocese. So she can hardly survive herself right now, you know. But she had to retire. It was getting too much for her. She had a stroke 10 years ago. She managed to work her way back to get to work. And this is how they treat you, you know. They have no respect, as far as I'm concerned, for anybody.
One of the places that I worked was in a hotel, and I was in a union. So I knew firsthand how it is when you are not part of a union. And when I came here, I was able to go to school, college actually, and I just graduated with my bachelor's. And they have been paying 6 credits every semester for all the subjects that I've been taking. So that helped me. If it were not $11.99, I couldn't have afforded that, especially in a private college.
$11.99 helped me out with my schooling because I was going to school for a bachelor's in applied sciences, and I was able to take my prerequisites over at the union downtown and with no cost to myself.
During my BSN, I had the union paying for everything, including my books. I finished my master's in May with minor in education.
The benefit fund is different than a commercial insurer because we exist solely for the purpose of providing health benefits to our members.
With 0 out-of-pocket expenses, no deductibles, no premiums, and no co-pays. We believe it's coverage unlike anything you've ever seen.
We don't take any profits, and we administer the fund as efficiently as possible so that the maximum dollar goes to the provision of health benefits for our members.
Last year I was diagnosed with ovarian cancer, and I didn't have to worry because the medical benefits and everything that we have through the union took care of everything for me, and any problems that I did have, I knew that they were just a phone call away. I am now 1 year healthy, and I didn't have to go into financial debt worrying about whether everything was going to be covered or not, because it was through the union.
I was in a hospital with major issues in Westchester for about a month, and they covered my entire bill, which was extremely high.
I've been there for 20 years, and I just lost my husband in November of last year through cancer. But I have to say thank God for the union and our medical benefit, because I have no out-of-pocket expense. There was no time that I had to spend a dime for my husband's medication.
I was pretty surprised, and my jaw dropped to the floor, as well as theirs, because they were surprised what we don't have and how it's unfair. We're just trying to better ourselves to better take care of our own people. And it just really surprised us, the wonderful benefits that they have, and we have nothing.
So I think it's the best thing to join 1199. If you have the opportunity to vote yes, I will vote yes.
When you make this vote, hopefully when you have a vote, a voting day, this decision will not be just about what you want, what your needs are. It's about your children, it's about your spouse, your partner, it's about your home, it's about your rent, it's about your health, it's about your family's health, it's about your family security, it's about your child's schooling. It's not just about, is this what I need? Is this what my family needs? And the answer is yes. Your family needs $11.99 as well as you need $11.99.